Thank you all for joining us today as we host Press Ganey for Vendor Feature. And as you most likely know, Press Ganey is one of the leading patient experience survey vendors. And I doubt there's anyone on the call that does not know that. But if you didn't, they are one of the leading patient experience survey vendors. In the last few years, so I worked for Press Ganey at one point, but in the last few years since I've left, they've really shifted their focus towards human experience, which I love. And so they are putting human experience at the heart of healthcare. Today, we're joined by Krista Peters, Dan Litwer, Ann Wellington, and Susan, their newest addition, and they'll be sharing what Press Ganey offers in support of the human experience through an integrated platform, including leading insights relative to the patient experience, associate experience, safety outcomes, and clinical leadership. During our time together, Krista, Dan, and Ann will also share an overview of their platform and tools. There'll be plenty of time for Q&A and discussion. The goal of this event is to give you experience with their platform and tools, give you an opportunity to get any questions you might have answered, and then learn from each other. If you stay with us after the hour, our events always add on an additional 30 minutes for speed networking. This is an opportunity to meet those who are on the call with you, add to your network of connections, and I highly encourage you to stay, meet somebody new, or connect with a peer that perhaps you haven't spoken with in a while. So let me do short bios about our three presenters. So Dan, along with his team, is responsible for nurturing client relationships. He oversees sales and client management, working closely with clients to help them understand what consumers expect, what caregivers need, and what patients experience. Dan has been a trusted advisor to hundreds of healthcare organizations across the nation. And Ann manages Press Ganey's relationships with other leading technology companies to integrate data and develop new solutions to improve the human experience of care. She also supports product strategy and corporate development work for Press Ganey and has spent her career in healthcare technology, including as managing director of the Cedars-Sinai Accelerator and chief product officer at Stanson Health. And Krista. Krista spends time with healthcare organizations and associates to explore the human experience, drive change, and improvement outcomes. She helps lead the team of associates who support the experience of working with Press Ganey and has also been at the forefront of organizations leveraging the human experience platform in healthcare. Krista has been working in healthcare for over 20 years, and her passion for the human experience drives the interactions she creates. So as I hand it over to Dan, Krista, and Ann, and Susan, I will now monitor the waiting room. Thank you so much for helping with that. Krista, I'll hand it over to you and your team.
Thank you so much, Denise. I was not anticipating such thorough formal introductions. We've been spending the last few minutes as we prep for the call kind of connecting and getting to know each other, which is one of my favorite things to do, and failed to connect on our intros. So we are delighted to be here today, and you've kind of already said who we all are. I wish we had time to go around to everyone who's on the call and connect and meet with all of you, but hopefully through discussion today, as well as the speed networking after, we're excited for that. It's great to see some familiar faces. Trying not to call or single anyone out. Marianne, okay, I couldn't help myself. And also some really familiar names, and it's great to be here with you. So thank you very much. For those of you who may have ever gotten the opportunity to work with me, know that I just love me a good old fashioned kind of game and fun, and I like to shake things up a little bit. So when we were thinking about this time and this hour, I thought, what better than to play a little Mythbusters? So what if we were to go about this and say, what are some of the common things that have been heard in the industry about Press Ganey? And what if we see if they still hold true? Are they true? And kind of tackle it that way. Dan and Ann, should we just jump in?
That sounds great. Let's do it.
Okay, all right. So I get the fun of just asking the questions of the myths, and Dan and Ann get to primarily provide all of the answers. So I'm really going to have some fun today. I believe I'm sharing my screen. Is that right? Okay, so we're going to dig in. Oh, go ahead.
If we don't know the answer, can we just popcorn Susan in?
You can popcorn Susan in, or you could always, I can't even believe I'm going to offer this. You could always say, I think you should answer that and popcorn it back to me. Okay. I would do that for my teammates, but let's see. I'm confident in you and Ann. So, all right, here we go. All right, our first myth of the day. Press Ganey is dependent on quantitative data only. We are a data company. Is that true, that is really what we rely on? Dan?
So this is the first myth we get to bust. We grew up as a company over the past 40 years on quantitative data, but as the market has matured, so have kind of our capabilities and offerings. And so if you think of no data without stories, no stories without data, you need to be able to complement the two and be able to pull in qualitative data to uncover what I call silent voices and members of the community that don't always respond to the typical quantitative studies. We call our black and white kind of our real legacy, and our ability to put major insight groups or data sets together for our clients and the industry as a whole to take really broad-reaching perspective of the information that we collect all across the country. And so what you'll see here is kind of a breakout of some of the insights around patients, caregivers, or team members, the consumers out there in the community and the markets as a whole, and then all of those very similar humans that are also members of the health plan, and us being able to kind of provide these insights all together to paint a real picture and to help organizations tell stories, leveraging these major data sets in a more compelling and engaging way for their staff to lead the improvement that's just so important.
Thanks, Dan. I think that you bring up the great points about the evolution and what we've been doing to change. All right, you ready for another one? You ready? Welcome to the new folks who've joined in the last few minutes. I know we're excited that you are here. We're just going to keep watching that flower bloom. Okay, the next one, Dan. Press Ganey is still doing everything the same way we've been doing it for 40 plus years.
True. Why would we change?
I have no idea, because it's working.
Yeah, nothing's changing around us. We should stay the same. It's really easy to look at things, over the course of 40 years and say nothing changes. We've made some really big investments in our people, our technology, and our process to make sure that we're a leading organization that can be a guide to our clients. And using the analogy, kind of help provide that insight into where the puck's going, rather than helping people with what they're using today or what they're looking at today. 40 years ago when Dr. Press and Dr. Ganey, yes, real people, for those of you that did not know, and yes, perhaps borrowing some real estate on a server in South Bend, Indiana, on the Notre Dame facilities, they wanted to understand the perception of patients and really get deep into behavioral science. And if you think of our core mission at understanding the voice of people or understanding the voice of patients, as we've partnered with the industry to solve these problems, we've realized that to solve for patients, it's impossible to help provide the guidance or improvement strategies without understanding some of the components that you see here on the screen. And so earlier this year, we launched what we call a human experience platform that takes kind of the four primary buckets here of patient, employee, consumer, and member experience, all with kind of like the interwoven threads of fabric in safety, quality, and equity. Being able to provide a platform for folks to engage with and interact with one common place, one information set for their staff to understand performance at a local and system level. As I work myself from inner to outer, our platform and our partnerships are based on kind of four key domains or pillars, and that is gather, analyze, visualize, and act. And our partners understand that it doesn't always have to go in that order. But I think we all agree on this call that we're here primarily focused on the action component of this visual. And so how do we gather information, analyze information, and visualize it so that we can take action and provide a better experience for whatever version of human we are looking to serve? And then the outer circle here, or the outer rim, we're here to play convener. We're here to convene individuals within an organization to work together. We know that organizations have silos and verticals in which operate at a high level, but don't always work well interoperably. And so we believe this platform can play convener. What we're also willing to do is be a partner to the industry as a whole, and to lead deep integrations that Anne will speak to a little further in her myth busting, but just really how do we connect where we're providing not just data connections, but insight connections, saving the hassle of clicks and multiple places to view things as we partner with the larger platforms to really be the experience cloud or experience platform of the future for healthcare across the globe.
Thanks, Dan. There's a great question in the chat that someone raised, which is, what is the difference between people and consumer experience? I hear them being used interchangeably. I think at the core, what we would say is that both relate, they're both the human experience. That's what it gets down to, is at the human piece. Often when we hear the use of the word consumer, it's really relating to the choices that people are making regarding their healthcare and other things. So again, they can be interchangeable, and I think it just depends on the context in which someone's discussing it, whether it's more at at the core of the individual as a whole, or some of the behavior related to choice and consumption of healthcare?
Yeah, I think simply put, it depends on the setting.
Yeah.
Most patients are members. Some patients are also employees of the organization that they're receiving care. And then we all have choice when we're not a patient or in an episode of care.
Yeah.
And so our ability to gather and report in which direction people are heading is important for the clients that we serve.
And I think it's important, as Dan was sharing about moving towards the human experience platform where we're integrating all of these things, recognizing that often the same person is the patient and the member and the employee. And historically, those might have been a little bit siloed into different areas, but we really need to bring them all together. So recognizing that while we may see them in different contexts and sort of address those contexts in different ways, we really want to bring that together into one view because it's one person going through their journey.
That's great. And Dan, we kind of already shared a little bit about this as we talked about that movement to really look at that gather, analyzing, visualizing, and acting. So taking the action. Okay, this is a big one. It's a common one. Press Ganey only promotes using good old, the longest possible form mail surveys on the planet. True?
Untrue.
Untrue. We are
So the
not
good news.
a company.
The good news for this group is 98% of all of our measurement is digital.
Wait, did you say 98%?
98% of all measurement is digital.
I just want to clarify that.
Now, we have a huge amount of regulatory work in the provider and health plan side of our work that mandates, minimums, maximums, requirements to use phone and mail, and we certainly are there to serve. I think we have the largest mail operation in all of healthcare, and that is to serve the needs of our clients. But the omnichannel approach of both the ability to capture active and passive voices is really what we're after. And so depending on what you're looking for, a 30-something item cap survey might be the right piece, and a 1, 2, 3 item survey might be the best in others. The idea here is we're trying to meet people where they are and glean insight into where we, as partners, are going to make a difference to the experience of those that are providing the feedback. And so you'll see here all the kind of terminology and images here of where we can capture voice. But the idea here is, in partnership with Press Ganey, you can really spread your tentacles out, and where folks are looking to interact with you, you can interact with them right back.
All right, I'm going to go to the next myth. And this one's for Anne. Anne, the myth that I've heard is that Press Ganey is behind in healthcare's use of AI and ML. And we should probably, can you clarify what AI and ML are, just to be clear?
Sure. So we're talking here about artificial intelligence and machine learning. They're often mentioned together. These are both functions that we use to process huge data sets and have very real-time reactivity to being able to better comprehend those and find insights that really the analytics engine is surfacing and identifying for us and being proactive and finding new ways to analyze that data. There's a lot of buzz right now about AI and ML. I'm sure most, if not everyone on this call has at least sort of curiously tried something like ChatGPT or some of the image generators that are out there. So that's one form of AI called generative AI that's creating new content and creating words or images. But there's a lot of other things that can be driven in addition to that by AI and ML algorithms sort of behind the scenes. So for those of you who are current Press Ganey customers, you're currently using likely a lot of our AI and ML capabilities through things like we mentioned, I think in a slide that was up a moment ago, Narrative DX and our NLP. We have all of this data when we're talking about actively gathered data. So the results from surveys, active patient feedback, as well as passive, things that we can infer about patients based on their interactions with us, even if they're not explicitly saying a score. We can use that and our massive industry-leading data set that we have going back 40 years of patient data to feed these algorithms and make predictive recommendations about things like what should we do next. You can see here sort of the intuitive action of behavioral nudges, next best action, pathways, closing the loop on service recovery. We're really using all of this information to help power predictive analytics. We also have work ongoing to create new products that are based on the AI and ML infrastructure. So this is a good example here of existing work that we do, parsing out a complex comment to say, this patient had a complex experience. We want to really represent that and understand not only overall how are they feeling about it, but being able to easily detect here's specific information that they felt positively, felt negatively about. This is tough to do. And it's especially tough within healthcare where we don't give everything exactly equal weight. So things like we really want to know when patients are talking about quality, safety, clinical care issues, those carry a lot of weight. We also want to know about some of their other experiences around things like food or parking or things like that, but we might handle those a little bit differently. A lot of ontologies that are used to analyze comments that are outside of healthcare, that are more general consumer comments, don't have the sort of intelligence that we've been able to apply to be able to interpret. So like an example I'll give is we could interpret if a patient said, I had a heart attack and the doctors took great care of me, we know that that's a positive comment. Algorithm that's not tailored to healthcare would see heart attack and think this was negative. This was a bad experience. People feel like that wasn't a positive thing to happen. So we're using all of this, not only sort of these powerful algorithms, but tailored to these healthcare workflows.
All right. Anyone have questions? I mean, I'm still trying to always understand what Anne says because it sounds so, it not just sounds smart, it is smart. And I'm always like, okay, what did I just hear? And what did she just say? But I want to pause for a beat and see if there are actually any questions around all of that, which Anne just shared. Well, I'm glad that you are, oh, go ahead, Denise.
That where we're going with AI, we're just at the tip of the iceberg. What are you guys doing with in regards to that? And where do you think this will go in our ability to really hear our patients?
Yes, I think that is so critical because one of the areas that we are using AI to get very specific about is it allows us to analyze people much more specifically. So if in the past we were able to look at large groups or cohorts of patients and say, oh, here's what we know about these broad sort of slices of data, AI lets us say, oh, we can compare this individual patient to other patients like them. And there's a lot of ways that we can identify them and say, we can help tailor an individual experience at scale for a particular patient based on what we know about them in particular and other similar patients. So it really helps us go from being a little bit more broad to very specific, but also doing that in a way that we can do that for every patient that we work with or get feedback on. I think that is important, seeing each patient as an individual. There's a lot of opportunity if we deploy these tools right to help it inform DEI initiatives and making sure that we're seeing each patient as a true individual and really understanding them more deeply. So I think there's lots of exciting work there. We are using and developing some of the generative capabilities. So that's similar to ChatGPT, things like Answer Assist to help address online reviews automatically and say, we can read this review and prompt someone with sort of a template or recommended response for responding to concerns, things like that. So trying to make the work of our frontline providers easier and helping to sort of have that person be supported by the AI in responding to things. I see a question from Sarah in the chat around utilizing AI in real time rather than after the fact or after they are discharged. So we have in development a few different approaches to managing this. So we have our rounding tools, and we're doing a lot of work around predictive rounding of recommending for a particular staff member, if they have certain patients they should go see, here's the patients we would recommend, sort of putting high on that list to go round on and go have an interaction with. I'll talk a little bit later about some of the work that we're doing to integrate with Epic. And we've talked with them about their tools like MyChart Bedside that also allows sort of that in-hospital integration to be able to gather feedback and prioritize patients to engage with. So lots of work there to move closer to not only individualized experiences, but as real-time as possible.
I'm going to keep us moving, and Anne, maybe you can type back in the chat. There's another question. I'm grateful that we're getting questions, and so I love it. So keep them coming. We're just going to do a 2-track here because there's nothing I love more than talking about one of my favorite topics, which as a previous patient experience leader, one of my favorite things is good old-fashioned stoplight reports. Can I get a thumbs up if you love stoplight reports? Yes, thank you for the chuckle, Denise. So myth for you, Dan. We prefer stoplight reports for data sharing. In fact, that's just about the only thing we offer because we love it so much. Is that true?
It's not true entirely. Listen, in all reality, organizations are on their journeys for improvement, and we're here to help enable and guide those journeys. And some leaders need stoplight reports, and some need the ability to really take a deep dive into information and study cross-domain analysis. What we're hoping to offer to the market is a platform that allows you to intuitively build and interact with what's most meaningful for you. I'm watching the time. This is like kind of our first intro into some of the color that we talked about earlier, but I'll ask Krista to just kind of flash through of just being able to look at different metrics. So you're not wed to one metric. Things like customer effort or likelihood to recommend or NPS being guides as far as outcome measures, but then really getting deep into sentiment to understand what are the emotions that are coming through in our feedback, both through quantitative and qualitative. Here's a really good look at different quadrant reports and NPS drivers to understand not just what the outcome is, but why is it happening? Where do we need to focus our limited resources? Bringing patient and staff voice right to the forefront. I can't think of a better way to share data than to put a patient's voice and video right in front of folks. Yep. Being able to look at experience moments through a journey. And this is not a unique patient journey, but the journey through an enterprise to understand like what are the pressure points in which patients are feeling friction or needing to apply effort. And so we can look through these live clickable dashboards that are repopulating every single time we click to understand where there's variance in performance across different domains or different units or offices or individual level performance that we can then dig into.
This one's my favorite.
This is
right.
This is just a great leader dashboard in my opinion. It's engaging. It allows organizations to pick the KPIs in the different domains that they're focused on. And right in the palm of your hand, be able to look at your performance as you start a day or end a day, or are reviewing with your team what it's like to experience your office, your organization, your unit, whatever it may be, across all the different things that you measure that all live within one common platform that's clickable as you tell your story going through it.
And I think one of the other things that I love about this one is, as we started with talking about putting the human at the heart of healthcare, right? This is like that visual manifestation of it. And that's why I think personally it resonates so strongly to me because, as someone who's ingesting some information, there's a different connection that I have to this visualization with people involved relative to the data. And then this is just the last one of what we'll share in terms of some of the visual ways in which that you can look at data. I took over, Daniel. Let me keep going. I'll keep going. Okay. So this one is a great example of what it looks like if you're thinking about it at a system level. And so here you can have this landing page of looking at all of the different pieces and all of the different care opportunities that exist within kind of the healthcare ecosystem. And then from in here, this is a dynamic tool that you can then, if I'm here, I want to go get some more information about post-acute, I can go right in here and get more access to more information. You have the ability to configure and create these kind of ecosystems to represent what the care looks like that you're a part of. So we're really excited about this evolution from the stoplight to this really robust picture. We call it pixel perfect visualizations. So.
And Krista, is this currently available or this is on your path?
No, this is everything you've seen today are things that are available today. Yeah. Oh, I love that. She hummed. She went, I heard it, Denise. I liked it. I got a yes. This is very much a real life thing. And we even have some people on the call that I know that have been playing with some of these dashboards and, have experienced it in real life. So how long has it been available? Yeah, it's a great question. We've had access to these tools for about a year now, but we've spent a lot of that year learning and listening to our partners. We've had a lot of co-design and innovation with some of our members to help design what these can look like and bring use cases to them. So yeah, it's been a year of development, but all of this is very real and accessible. And Gary, great question. Yes, the MD experience. All of these can be made to include that and intend to include that as well. And so a great question, but definitely not left behind there. All right, I'm going to keep us moving to the next myth. Oh yeah, I love this one. Dan, Press Ganey cannot support real-time service recovery. We just can't do it. Is it true?
So We can support this. We can support this in a few different ways. And the industry as a whole has a thirst for real-time data and a hunger for service recovery and a hunger for unique patient-level journey mapping and things of that nature. And if we had all that resource in healthcare, then we might have different outcomes. We don't. And so what's really important is leveraging all of these tools to be able to deploy the right resources at the right time where we're going to get the most bang for our buck. And having one more alerting system within a health system is the last thing anyone wants to sign up for. And so if you think of the sentiment analysis that Anne was going through, kind of feeding our real-time tools to make sure that we're understanding the unique language of healthcare so that we can trigger alerts into the palm of someone's hand to say, this is who they need, what they need, when they need it, is really what our action management tools are all about. And so you can activate and deactivate. We can link in through our platform to the tools that you're using for action management like things today so that we can build into that infrastructure. But the idea here is if we get something that's really positive that we want to share with staff, we can boom, alert the right person to see it and share it. And if there is a person or a patient in need, we can alert someone by simply pinging them right on their phone and saying, this is where you need to go and what the next best action is. So it's a myth. Just like anything, it's how you use these tools and what you have the ability to leverage with the resources that you have, rather than paralyzing an organization and trying to roll something like this out at scale. But the tooling's there, and you can customize and configure this to action to the right people at the right time. So service recovery is a huge component of the ability to interact with folks real time.
Yeah, thanks, Dan. So there's been a lot of buzz over the last few months about integration, and we actually had a call with this community about integration with EHRs. What was that, 2 months ago, Denise? And we actually talked about the announcement that Press Ganey made about the partnership with Epic. And so since then, there's been lots of questions and lots of dialogue in the industry. And so want to bring up a myth, Anne, that Press Ganey only connects with Epic through reporting tools.
Thank you. It is a myth. So we do connect with Epic through reporting tools. Epic has their external data connector that can be used to bring Press Ganey data into some of their reporting tools for use in things like Slicer Dicer. So there's customers that are using that robustly. We also, over the past months, have been engaged in much more deep integration to move beyond retrospective reporting and figure out how can we get more real time and more forward looking in a variety of ways. I've seen some questions in the chat that were perfect queue ups. I kept saying like, oh, I'll address this in a second. So let me actually start with some of the chat questions, which were asking about, can we use AI? Can we use ML to flag patients the next time they're at the organization to make sure we're not repeating issues? And you can see on this slide that talks about some of the functionality we're currently developing. That middle column is talking about Epic CRM called Cheers. And they're developing some structure that allows us to share patient insights back for storage in Epic with the goal of surfacing it to experience leaders or to folks who are interacting and managing patient experiences, either through Cheers or potentially through other places in the system, and being able to flag patients either giving summaries of the responses that they've given in the past. So some of that sentiment analysis that I shared, themes that patients have talked about that are important to them, and being able to both have that information in general and generate service recovery flags. So if you are using Cheers for service management or service recovery, auto-generating tickets there so that you can quickly and easily follow up with patients who need follow-up. So definitely an area that we're doing development work on now. We're targeting for that initial functionality to be released as part of the Epic November 23 release. So it's coming a little bit later this year. If you're an organization that uses Press Ganey and Epic, your exact timing will depend a little bit on when you do your Epic upgrades, but we're working on the initial functionality that you see here. As we move forward and think about what else can we offer to providers who are logged into Epic all day long, I know a lot of our experienced users will log into Press Ganey tools to get feedback, but we have a lot of folks in hospital organizations who might not log into Press Ganey tools. Reaching them through the EMR is a great way to offer them insights. And so we're working on patient recommendations that are guided by AI and ML to say, based on what we know about this patient and other patients like them, how can we help this visit be as positive as possible? The last information in here that I want to note that's noted at the bottom there, because we always get questions about it, is our plan to sort of surface raw survey responses to providers? Will a patient say, I didn't like this doctor, and then we put in their chart, they don't like Dr. So-and-so? And no, part of the benefit of us working together is Press Ganey can take that data, analyze, process it, and provide guidance and recommendations while still protecting that patient provider relationship. The last thing I'll mention here, just in the interest of being complete, is that we're working on integration with MyChart. So starting with traditional MyChart for survey delivery. And as I mentioned earlier, longer term looking at MyChart bedside integration for that in-hospital experience. I also want to shout out, I see some of our Epic folks, Trent and Kartik, on the call, who are Epic engineers who've been deeply involved in this work. They love it when I shout them out every time I talk about our Epic work. So thank you, Trent and Kartik, for all the work that you've done on this. And I'm happy to see you on here. I know I can continue myth busting about this, but I know we might have more myths to talk about.
I think Krista is having
Krista.
My internet keeps freezing. I kept, yes. Okay, so I'm gonna, didn't help.
While Krista's sorting through technical issues, I'll talk a little bit about the question around patient and employee experience. So definitely lots of work we're doing there. My lens that I look through is the Epic lens. And one of the things we've talked about in the future is both using Epic as an engagement tool of things like potentially gathering engagement surveys through Epic because they are sort of logged in there and using that all day long, or using the data that's there through Epic's tools like Signal, aligning that with some of the data we have around things like flight risk analytics and burnout analytics to be able to highlight areas of concern. So definitely lots of ways that we're looking at doing the integration that we talked about at the very beginning of the call of our employees are part of this entire sort of loop of patients and members and employees sort of feeding into one another. So lots of work happening there.
Yeah, and I'll take the bait here. I have a brother, Jeffrey, with a G, so I will address the question to Jeffrey with the G. Just as far as the employee experience side, we have kind of end-to-end listening that's right at your fingertips. So from onboarding 30, 60, 90, 360s, exit, and any type of pulse or crowdsourcing challenge, it's all part of our suite for what we call workforce, includes employees, clinicians, et cetera. So the ability to capture the capabilities to capture real-time data exists on our platform for wherever you're looking to listen. Again, deploying the appropriate strategies for your organization to take action and make sure that those voices are responded to is certainly included in the partnership and how we leverage our ability to guide.
Thank you for your patience while I was having internet connectivity issues. So Anne, I may have missed it, but there was kind of a subpart to that myth, which was, if you said it while I missed, again, my apologies. What do the integrations look like beyond Epic with other EHRs? Cerner, did you talk about that?
I didn't talk about that. So we have long-time integration support for many EMRs. So the ability to send that EMR data to us for us to be able to administer surveys. We've supported that for a long time, and we will continue to support that long into the future. We see Epic as our innovation partner for moving this work forward. And so when we think about the new things we're doing around service recovery and some of the more predictive and forward-looking work, Epic has been a really critical partner for us in how we think about that and how we're sort of creating those new workflows. It's likely that at some point down the line, in the sort of spirit of serving patients as well as we can, we'll make similar functionality available with other EMRs, but Epic is our primary partner at this point in developing those new workflows.
Thank you, Anne. All right, Dan, I got a question for you. We have 2 minutes left, and then we'll get to even more live Q&A. You've been all doing a great job putting it in the chat. So 2 left, coming around the corner. Press Ganey has changed its service model. That's what I'm hearing. What's the scoop?
So that's not a myth. We just as we invest in our technology, we invest in our people. I think fundamentally over the past couple of years, we've made a concerted effort to really double down on being a listening organization, and we have listened to the market and really tried to kind of respond back with what folks are looking for, and working with the organizations that we do at the scale in which we do is something we're really proud of, but being able to serve them is really important. And the reason organizations choose Press Ganey is because they believe that we're the best partner at the time for what they're trying to solve. And typically, one of the heavier weighted items is that we are a team of healthcare leaders. We're built similar to our clients. We have, thousands of years of healthcare expertise and knowledge. And so what we heard from the market loud and clear were, we love working with our teams from Press Ganey, but it's confusing who's who. And more importantly, it can be confusing of how we get to the insight. How do we get to the best practice? How do we meet the folks that are doing it best? And so we're in the process of change management, which is probably why you hear a stir. It also gives the vendor population at large opportunity to talk about it as well. We've aligned around our clients. We've given you one hand to shake, so one single point of contact. And then instead of having an individual to go to for improvement or an individual to go to for networking, we've broadened the approach to allow us to align you with the expertise that you're looking for. And so we have our nurses congregated in a center of excellence so that when nursing leaders need something specific, we can deliver the right nursing leader with the expertise needed rather than sharing information through individual people. And so we've kind of opened up our platform, both literally and figuratively, to allow our clients to get access to the folks they need at the time in which they need it. And so we're really proud of what we've built here, and certainly continue to listen. As this rolled out about a year ago, we have continued to make tweaks to our support model and work around our clients' individual needs. But this is something that we felt really kind of opened us up and made us really transparent of what lives inside the organization.
And to answer the question about how our service model supports, understanding regulations that are changing, we have a team dedicated to understanding policy and being proactive around what those implications and indications are for all of you as partners, so that we are prepared to support that. So we do that through, proactive outreach and communication, as well as Dan said, having access to individuals that can discuss and provide support and recommendations to meet those changing needs, including relative to population health management. All right, last one. Okay, there's a lot out there. We've talked about a lot of things, as we talk about the patient experience and the employee experience and consumer experience. So here's a myth, Dan. Performance is not impacted when multiple vendors are used to capture data. So if I'm using lots of different folks, it doesn't matter. My performance will be the same.
Yeah. Let's leave it as a maybe. We'll let some of the numbers do the talking. But before I get into the numbers, the value statement that Press Ganey brings to the market right now is a consolidated and integrated platform for all things experience. It gives you the opportunity to put insight and information kind of in real time at work together. But what it also serves, and I see some chatter in the chat, is it reduces the lift on your IT team. It's one installation, it's one application to manage, rather than the dozen or so vendors that play around health systems and health plan organizations as it pertains to experience measurement and analytics. And so that as a whole is part of the mission of reducing costs and creating efficiencies in US healthcare. And so we are leaning way into that movement. The numbers themselves, this is just simply a look at our database. And we could try to poke holes in this the best we can. We're not identifying any organizations. We are not even here to say that these organizations are integrating the data and they have teams that are deployed as one experience improvement team. But the organizations that use Press Ganey for these experience measurements outperform those that don't. And this is just within our database. So if you don't measure with Press Ganey, you don't participate in this, and perhaps you're an outlier. And outliers exist in this data. But this is big, heavy database information, and 18 percentile ranks better or 28 percentile ranks better, depending on what patient experience outcome measure you look at. These are really compelling figures to take the first step at putting this information together in one consolidated platform.
Thank you, Dan. All right, it's enough of our slides, enough of our pictures, and I appreciate the interaction so far, but let's open to some other questions if you want to raise them, and I'll hand it over to Denise. How you want to take it from here?
Yeah, before you stop sharing, I wonder if there's any slides that somebody on the call might want to see again and ask specific questions to. And if not, then let's stop sharing so we can see the whole Brady Bunch of faces. So, Brian Carlson, you said you're using some of these new tools. And so the ones I'm really interested in are those, I had written down, well, those are really pretty pictures, but is that real? And you said, yes, they are, Krista. So I'm curious, Brian, are you using those? And tell me a little bit about them from the user side experience, if you wouldn't mind. And Krista, could you go to that slide with all the pretty pictures? There were a couple of slides.
Okay, don't get sick. I don't know how to do that. Real quick. Don't watch.
Oh.
Slow down, Krista. Whoa, hold on.
So this one is really cool. Yeah, Brian. Yeah.
I mean, so I think what they've shown here is the opportunity, and we as clients view we view data different ways. The power of the platform is they can customize it to what our needs are and make it very interactive like this, or make it the stoplight of what goes on and off. And I think traditional reporting platforms gives you one tool, one way of doing it, where now it's really up to the organization to partner with Press Ganey and say, what are our needs as the client? And then how can they build a dashboard that best meets the views we're looking for to get the data we need in the ways we want? How do we want to visualize it? So it really comes down to visualization. And I've seen some of these I've seen, some of them I haven't. Ours look a little different than some of these, but I know partners who are using these exactly, and they're very pleased with those views. So it's up to us as clients and how we want to use it.
So when I was with Press Ganey, we had new Press Ganey Online. Is this new Press Ganey Online?
I'll take that. We refer to our modern platform as the human experience platform. So Press Ganey's human experience platform. And so within this platform, you will see legacy things from what's called PG Fusion today that are brought into or onto the platform. And so Press Ganey brought to the market products and reporting sites for our disparate solutions. Now the HX platform comes with kind of like a brand new skin, which I can talk about a little bit, but all these components kind of living on platform, allowing for information to be pulled across. It's been, someone keep me honest here, a little over a year since Press Ganey acquired a company called Forsta. Forsta's the global leading market research platform and consumer experience platform. And so what we've done is we've built Press Ganey into this platform and pulled in all these types of widgets and things that you see here that you can leverage with your data. And so these reports can be configured by the users of the system itself, or you can use the templates created by Press Ganey. Whereas in legacy Press Ganey reporting tools, you had the reports that were provided to you. And you could request custom reports, or you could build queries to create your own reports. All of that functionality still a part of this universe. Now you can create, like if the bar chart's on this screen, if you'd rather see them in a line chart or in a donut model, you could just simply click on it and change it as a user of the system. So it's real enhanced, like deeply rooted in market research reporting capabilities, where super users can simply configure as they wish.
And Krista, one of the slides had people with NPS scores.
My favorite one.
And I'm really curious because, of course, what stood out to me is we have this ongoing debate about are they patients or are they consumers? And you have both on this slide. And I'm curious how you're distinguishing the difference between patient and consumer.
Yeah.
I'll take this.
Okay.
If Denise, if you think a patient is someone that we are asking about a specific care experience. So it's point in time. It's either during a visit or post-visit or during a stay or post-stay. The consumer experience is where your marketing team is measuring brand recall, brand awareness. It's where we ask someone on the website, did you get what you needed? Did you understand the availability of a clinician or the wait in an ED or things of that nature? Or you interacted with our contact center, but you didn't make an appointment, right? Those are things that we consider on the consumer side, as well as what people are saying publicly. So we're ingesting all of the public information and reporting that back through all of our sentiment analysis and AI tools.
And I think that's great because to that argument, it's yes, and they're both, right? It depends on how they're interacting with you.
The simplest thing is Brian Carlson could be contributing to every single one of these data points. He could be each of these people because he's a member. He's also an employee of the health system, and he's reporting outcomes.
And Brian, you were called out, but I also see your hand up. I'd love to hear from you.
I think he's just waving at me.
Oh.
I wanted to expand just on one thing, your question earlier, and that is with the new platform, and they didn't really touch on this, but a myth that I think has been busted that they now offer is the ability for us as clients to build these dashboards and also build surveys within the platform ourselves. So we don't have to go through the traditional support models of waiting for layers and layers and layers of individuals to build surveys for us if we want to do it. We can do it that way, but with the new platform, we have the capability to curate dashboards and also surveys to go out to certain populations or all populations by adding a question in almost close to real time. It's not quite real time, but there is a turnaround there, but we don't have to wait weeks and months on end to get something done. And that's been incredibly powerful as well.
Thank you, Brian. And to dovetail, it kind of spins into the question Sarah put in the chat, which is why I'm showing this visual, is that there's just so much more flexibility than there ever was and configuration that is available. So, this is looking at more of top box scores. It's not about NPS. It is absolutely at your choice to pick any metric and how you want it represented. Whether you just want the top box of likelihood to recommend, right? Or you want a calculation of NPS, absolutely a choice.
And can you mix and match, Krista, if you've got?
You can do anything you want, Denise.
Nice.
Well, I mean,
yeah.
Yeah.
All kidding aside, we have organizations that leverage multiple outcome metrics like likelihood to recommend and NPS or human effort score. And so you could have a dashboard with all three that are, serving different uses.
Marianne, I'll go to you next, but Dan, you just said something that really stood out to me, human effort score. Can you define that a little bit more?
Yeah. So, we've looked at where trust is eroded. And so we've brought in friction maps and hassle maps. And really what we're trying to study here is what is the level of effort that an individual is putting into an experience. And individuals are going to have a breaking point where they say, I'm not putting in any more effort for this. And unfortunately, today, in many consumer experiences, healthcare is not exempt. Individuals have to put too much effort and they leave the interaction, or they take their consumer spend elsewhere. And so what we're trying to understand here is what are those levels of effort so that we could look to reduce those friction points and make it easier to get through our systems.
Marianne, I see your hands up. Thank you, Dan, for that.
And I'll just share in 60 seconds that one, it was a pleasure to be with all of you. And I'm going to leave my email address in the chat in case anybody wants to connect on anything moving forward, because I can't stay past noon. But what I wanted to say is perfect segue from what Dan just said. We find that trust is eroded in lag time, from the point of experience to the point of any response, if there is response. So what we've taken advantage over the last year is the new tools that Press Ganey have offered us that really capture real-time feedback, whether it's the 3 million text messages we send into our ambulatory population for every single encounter, and whereby Press Ganey loops back to the individual manager same day with any rating that is not as we would like it to be, but also to inpatient surveys, QR codes within the unit, within the room itself, that allows us to talk to people as the experience is happening. We find that trust is eroded and lots of other bad things happen in the lag times. So we're not waiting for, paper surveys to come back and data to be compiled. We are working more and more every day to talk to people as they are receiving our delivery of care. And there've been some extraordinary new tools with the merger of Forrester and Press Ganey that have enabled us to do that. I'll put my email in the chat, so anybody who wants to connect at any time, I'd love to. Thanks.
Thank you, Marianne. All right, so we are coming to the top of the hour, so I'm going to go ahead and wrap up this segment. We will be hanging out, anyone who will join us for speed networking. So if you get in a room with Dan, Krista, or Ann, you might be able to ask some more questions after everybody's been able to introduce themselves. So I am so grateful to you, Krista and Dan, for joining us today to bust some of those myths. I love the format that you chose. That was fun to show some insights. As I said in my email to you earlier this week, it's been years since I've worked with Press Ganey, and I'm sure things have changed. I am very surprised in regards to just how things have changed. So this was a true learning moment for myself, and I hope for so many others who joined us today. To all of you who did join us today, thank you for doing so. This was the most attended event of the year thus far. Again, tells to the poll that Press Ganey has, the interest that there is for this topic and what you're providing. And I do encourage you all to join us in further conversations. If you look out at the PX Communities business page on LinkedIn, all of our currently scheduled events are out there. Please register, join us. More events will be added all the time. We're shooting for almost 40 events, I think, this year that we're holding. They are very much in this type of structure. When we have some content to be shared, but we also hold open conversations once a month, which is, you guys are the experts. You're bringing it to us in conversation and we're learning from each other. So those are really fun events to join as well. So again, I had other questions to ask Krista, Dan. So if those on the call would allow me, can I ask a couple other questions? Then I can capture these and add. The new platform, the as I call them, the pretty pictures that you showed, are those integrated with somebody's contract, or are those an add-on?
So before I answer the question, I just want Jeffrey to know that he's not alone, and that Susan, Krista, and I all worked at some point for competitors of Press Ganey. So you're amongst friends, whether you know it or not. So it's not included in the underlying agreements with our clients now. There's the technical aspect of their features and functions of the new platform that need to be written into SOWs and security compliance and things of that nature. So you can't just activate it. And the new platform opens up to a big open platform where we're not looking to kind of like charge based on usage. And give people the ability to like turn things on and turn things off and increase their bill and decrease their bill. We're really looking to build platform-based relationships, and so it takes a rescoping of the relationship to give access to these tools, because you could get lost in the capabilities of the platform. So new paper is required.
And Dan, that kind of steps into a second question. What I had heard from Brian when he was talking was there are pieces that you turn on or off. You kind of customize it to yourself, and that you can add your own questions. So how much of that is the client needing to own the build? When I think of Qualtrics, what I've heard is the client really has to own a heavy lift of the build. Is that similar in the new platform for Press Ganey?
Yeah. So it goes back to us being a healthcare company, and we all play in and around the similar circles. Healthcare cannot use self-service in its entirety, and we're not going to do that. And so we've always been a white glove organization that implements technology with our partners and helps ease of use. Now, that's not to say that, Denise, you couldn't spin up a survey on your own during this call and blast it out to however many patients you want. And if you wanted to, you can consult your team and we could build it with you. So it's from 0 to 100 as far as how much white glove you want. But we scope all Press Ganey partnerships for the account team to be in tune with our products and solutions, understand the outcomes, and be able to advise on how to use and how to improve. We're not going to drop a technology tool in the hands of folks.
And that, of course, cues up another question, or just perhaps a comment. As I've worked across our nation with different patient experience professionals, there is a broad range of competency in the individual who is in the role, not for lack of want or desire or wish. There's just such a gamut of things for a patient experience professional to be competent in, one of which is data, survey construct, etc. So I love that you wouldn't just leave them all alone to try to figure it out on their own, because we all know there's a difference between a well-constructed question and a not well-constructed question, as well as how you then take that data that gets returned and make it understandable to yourself and others. Okay, so my other question. I love that your platform has the employee element into it. And I know in the past, those surveys, patient, employee, have not intertwined very well to give us insight to patients are feeling this within a department. What's really going on in that department or clinic? Is your platform moving forward in that regards as well, to give some better insight so that we have a little bit more understanding of the root cause to what the patients are experiencing?
So I wish Anne was here to talk to some like the technicality of the ML. I'm going to do a little myth busting, kind of like of my own. Having the data together in one place is a huge win. Having the data co-displayed at a unit or human level, really, really important. tying up these data together and spitting out root cause, not sure we're going to get there on like where the work happens. And so like, could we look at an organization and say, like, here are your top priorities? Like we can do that today to look at kind of like the overlapping of the information. I'm just not, like, your question goes to a pretty granular level of detail that I don't know that even with the generative AI and machine learning tools that we have, I don't know that we're going to get to root cause, more thematic things and key drivers that take the interdependencies of different data sets, if that's fair.
Mm-hmm.
So I'm looking to not overpromise.
Mm-hmm.
And we're going to see where the science comes about. The real reality is organizations being able to map their hierarchies of the way they look at staff and the way they look at where patients receive care in a meaningful way is challenging in and of itself. And then being able to tie those data together at a local level, it just gets challenging.
Mm-hmm.
But part of our mission for sure.
Yeah. And to that, you're right, Dan. So I remember when I was an advisor for one of the California-based clients who called me towards the end of their fiscal year to ask me how come our data dipped in April and August. And I went back and looked at my notes, and they had nurse strikes in April and August. Mm-hmm. There's a root cause. Mm-hmm. But being able to elevate some of that. So what I often say is our patients can only tell us what they experienced. They can't tell us what was going on that caused that experience. Mm-hmm. And so how do we capture as an organization those other key indicators that we don't excuse away? We can say, yes, we're going to expect to see it. A nurse leader turns over, I'm going to expect to see the data drop for that unit. That is typical. So how do we track that so that when we get those ups and downs, we're not always going, why, but we can understand the story behind the data?
Yeah, I mean, you're speaking our love language, right? Like if my opening was no data without a story and no story without data. And I mean, like we've all been in the situation where we present data without a story or an understanding of what's going on. I mean, seasonality just in and of itself, when you're looking at data as point in time, can get you in a whole lot of trouble.
Mm-hmm. I think, Denise, what you're articulating and that, that we appreciate is that the data is not the answer. It's merely telling you where you need to go to do some more inquiry. And so as we add layers of data, we can get a more focused point of inquiry, right? So, but there's still always the need to get what the story behind that data point and time. And the data itself just is not the answer, right? There's more needed for sure.
And too many organizations only look at the data and don't seem to understand that. Allison, please. Yes.
Yeah, because I was going to say, when you're talking about the hierarchies, one of the things, again, with a huge healthcare system, we quickly, when I was there, went from just having the HCAPS survey to adding ED, inpatient peds, the multi-specialty clinics, OAS CAPS. And with, 36 outpatient specialty clinics, 4 different directors, we were very challenged to determine how to start integrating, our physicians or the specialty clinic directors or all of the clinical directors in access to this data in a meaningful way. And, when they weren't a real data literate, group at that time in terms of like patient satisfaction data. And, because one of the things I had asked for was even just being able to break out the multi-specialty clinics, maybe based on dashboards for the 4 different directors based on just their specialties. Mm-hmm. So I don't know if this is something that, this human experience platform will be able to do, but I love the visuals. I'm a visual person. Okay. And I think it's really going to be beneficial for those larger health systems.
No, I think that it's a number, right? It's a data point, and physicians are scientists. They're all about numbers. Many organizations are physician-led. Administrators always trying to balance the budget. So I get it. But the reality is there's a human being behind that number, and everyone is a unique individual. So as leaders in patient experience, we have to kind of wrap our arms around it so that we can message it in such a way that, to Dan's point, there's a story, right? We're always leading with a story. We need to capture folks and get them to hear and listen and understand, actively listen, so that they remember it's all about the human being that's behind it. I think the qualitative component is so very important, and it's easy to look beyond that and just focus on what our goal is and where we need to be to hit 5-star and where we need to be to hit our stretch goal. But the reality is the qualitative piece of it, in my mind, is almost more important, because if a patient takes the time to write or type a comment about the way we made them feel, which is what patient experience is all about, right? It's not clinical acumen, it's about how we make people feel. Then shame on us if we're not sharing that at huddles, at leadership meetings, and lifting that voice so our patients can be heard. And the other component that I think is so important are those advisory councils, the patient and family advisory councils. We need to do a better job as healthcare organizations of including our patients and their families and their advocates in process development. And when we do, when we build new facilities, have them look at the floor plans and give their thoughts. I did that a few years ago, and they saw things on those floor plans that we didn't see. And then when we brought them through with their hard hats on, they saw things that we didn't see. So, I think it all goes, to your point, Allison, I agree with you. I think, we focus on the number because, that's where the dollars come from, in a sense, on that inpatient side in particular from CMS, but it's really about the human being that's behind the number. So I think as patient experience leaders, we need to help educate and train and orient those leaders around us to really use the patient's voice to share what the experience is all about. And I'm excited about the new human experience platform. I'm a Press Ganey client. I haven't seen some of these views yet, so I'm really excited to see what's coming next. And I'm sure my account director will be partnering with me on that. Love the visuals. Everyone loves pictures, right? So I love the fact that we're looking at it more as a visual rather than, spreadsheets and just data, because it's so much more than that.
Jeffrey, I saw you come off mute briefly. Did you have?
I was just going to make a quick comment about the employee side again. And we were talking about data and how do we act on it and things along those lines. One of the flaws I've seen in healthcare organizations is treating employee engagement, that side of it, as a organizational metric. Whereas in reality, engagement is owned at the team level. And this was one of the things I saw in watching my wife's care. There was a social worker, there was a food service employee, there was a housekeeper that was working with the nursing staff on that floor to create the patient experience. And one thing I've had success with in research-based employee engagement is figuring out that the measure needs to be at the team level, not the organizational level, because there's not a lot that can be done when you're looking at organizational metrics. But if we see what teams and what dynamic teams inside a healthcare organization are moving the needle, then we can figure out how we make more of our teams like our best teams.
What a great way to end, Jeffrey. Thank you. Thank you all for joining all the way through. I love this portion when we can have a little bit more of a conversation. Krista, thank you to you and your team. This was fantastic, greatly appreciated. And I hope each of you have a wonderful weekend and join us again in the future for a conversation. Bye-bye.
Thank you. Bye, everyone. Be well.